Michigan Trauma Burn Center. So I am, just if you're not aware of who I am, my background is actually in critical care nursing. So I have been a burn nurse for, oh gosh, over, I guess, about 33 years now. So I run our hospital-based youth fire setting prevention and intervention program. So it's a little bit different from the standpoint that it's a youth fire setting intervention and prevention program that's run by a burn center, but we do a multidisciplinary program that we utilize fire departments and law enforcement, burn survivors, actually a former youth fire setting arsonist that's involved with it, social work and other things. So long story short, I'm here to just to help you guys in whatever questions you have or your resources that you need or anything like that. Anything that we have developed as a part of either the program that we've established and or the national resources that we've built as a part of that are yours to use too. We just ask, that you cite that it's from the University of Michigan.
I muted you, Del.
As an aside or whatever, I also am a National Fire Academy instructor for the youth fire setting, the whole suite of courses, if you will, and was one of the subject matter experts that helped build that too. So if I can kind of speak to a bunch of different aspects of this issue as you are interested.
I know a lot of people were really excited to see you and probably have a lot of questions, but I think most of us have not been to the course at the academy. I think there's a couple people in the state who have. Is there anything we can do to get off the ground before we have that under our belt?
So if you're just kind of starting to come together and trying to just give people a little bit of an introduction to this topic and just to create some baseline understanding and education about it, there are two easy, accessible, and free. That's always a big thing too, right? And online, easily accessible resources I'd suggest. One of them is the free online course that was developed as a collaboration between IFSTA as well as Vision 2020. I'll give you guys a whole bunch of links so you don't Marcy, do you want to, the best if I just give them and you guys push it out to
Sure,
people via
that'd be
email?
great.
Does that work?
Yeah.
Okay, as opposed to putting it in the chat. So I'll share that. So that course is a self-paced online course. It takes about an hour to an hour and a half roughly, and it's meant just to be an introduction to youth fire setting. It was intentionally developed to help, so you can use it for yourselves. You can also share it with crews, with other people that maybe you're trying to get interested in this topic. So like if you're trying to recruit like stakeholders, maybe other adults or professionals that aren't at all like familiar with this topic at all. So maybe a certain, school staff, other partners in the community that are just like, they're like, I don't even know what you're talking about, or why would I be interested in that? That's kind of a potential thing. You can encourage them to take it too. The other part of that is that course is actually also a prerequisite to be able to take the National Fire Academy courses. So bonus, if you go ahead and take it now, as long as you save your certificate, you can keep that and use that as a prerequisite. So that's one thing. And then I did a webinar that was part of the USFA Arson Awareness Week, like a year ago or so, and that was just kind of an overall summary of the topic too. That was recorded as well. So that was an hour, if you're interested in like seeing that was just kind of like a brief, like sort of overview of the issue, talking about the issue in general, and then kind of talking about some trends and kind of maybe where we need to go going forward. So that might be another easy way to look at this.
Okay. The first time I heard you speak was a couple of years ago. And now I'm not going to remember what the terminology was, but you talked a lot about brain chemistry and how the things that happen to us as kids shapes where we're headed, basically. Um, there was a class that was involved with that too. Wasn't there a training?
So I don't know maybe where you heard, but some of the I should probably clarify. So I've also worked a lot in kind of the research realm. I was our research nurse in that. So if in full disclosure, I'm a total data like geek and nerd. And if I wouldn't have been a
Join
critical care
us.
nurse, I would have been probably an engineer or an investigator. So I gotta throw that out there. So anyways, I I like to understand how things work or why they work. So I was the kid that like took everything apart, like I had the teddy bear that had the music box in it, and I was like, what's going on with this? And I was like pulling it all apart, and then having to try to put it back together. Anyways, so yes, when I got into working with kids that were setting fires, the question is to me was always, why is this happening? And certainly the 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 webinar and then the online course that I just mentioned kind of scratches the surface at that. And if you take the National Fire Academy courses, which there's, I can talk a little bit more about those in a minute, but they'll get into more of that, like the motivation and the typologies and all those things or that. But with all of that, I still said, what are some of the factors that drives a kid and or might be motivating them? And every kid's different, but certainly for some of the kids that we work with, it's some of the trauma or some of the adverse childhood experiences that a kid has gone through, that it's not an excuse. Um, and it's not to say that just because a kid has had adverse childhood experiences or trauma in their life that they're going to set fires. But what we do know from data and research is if a kid has gone through some traumatic events as a child, they are it's known that they are more likely to engage in risky behaviors throughout their life. And fire setting is one of those. They're also, it's tied to long-term mental health conditions, so anxiety, depression, things like that. It's also tied to chronic disease like obesity, disease, cancer, um, substance abuse, alcohol, smoking, a whole bunch of things. So that maybe that's what you'd heard,
Yes. Yeah.
okay, yeah, yeah. So, not every kid who has been abused or witnessed violence or been in, had experienced some traumatic event, not every able to set a fire, but definitely we know that that can be part of what is happening. And specifically with youth fire setting, um, what the data and research shows us is about 50% of kids who set fire have some kind of an abuse or adverse childhood experience in their history. So what I always tell people is if the data and research says that, what do we think the real number may be? It might even be higher. So why I bring that up is as you're working with kids to set fires, and this has been my passion for this, is I get work with a whole bunch of kids who are quite frankly a total pain in the what. They're hard, they're challenging. They're the kids that are getting kicked out of school. They're the ones that like nobody wants to deal with them because they're just a total pain. And they look bad on paper too when you get the referral and all that. And they're difficult to work with. But the reality is you may not know what they've gone through in life. And if you pause for a second and say, not what is wrong with this kid, or man, this kid is like a real problem, and paused and said, oh my gosh, what may have happened to you? And talk to me about what's going on, and let's figure out how we can help support you and redirect you. It can be absolutely transformative and life changing. And so that to me is where this work is amazing. And on a regular basis, this happens all the time. Just us pausing to care about that child and showing that we want to work with them, or that we want to do something with them, can be enough to make a difference. So I hope with whatever else you guys do, that if you remember that part, that you're going to make a difference by just wanting to be in the space. Dawn, I see you have your hand up.
Yeah, Carla, can you hear me? Okay. So you said, you know, sometimes you don't know what these kids have been through. And I've had an experience where a school called us in because they were aware of some fire setting behavior. So we came in to do the education portion. And we very quickly realized that, you know, we can provide our education, but what's going on there is actually, these kids were talking about, it was some siblings, and they were talking about they didn't know where they were going to sleep that night. And, you know, so they, not only are they unhoused, but there's probably some food issues and things like that. So do you have any suggestions on really creating a good networks to be the best resources? In the past, I've kind of leaned on school counselors when, you know, when they're available, when they're in session, because I kind of feel like they probably have access to more resources than we do, potentially, when you're into these situations that really go beyond our capabilities. Can you provide any advice or suggestions on kind of building those relationships, where to seek those relationships, how to create that foundation in your community?
Oh, thank you for bringing that up. Yeah. It, I'm going to share that, yes, all those social determinants of health that you're bringing up, such as food and housing and unsafe housing, even if they do have housing, is it safe? Possibly violence in the community, all those kinds of things can be very real things that this child and family are working with. And so that what you just brought up is what I'm seeing regularly with the kids that I'm working with, is the biggest barrier. We're going to always do our education, and we're always going to do the fire safety education. But what I'm seeing is we can give them the education and they can know what to do, but can they do it because of all the other chaos and all the other stuff that's happening in their lives, in their house? And so that's exactly what you just touched on. So this is not to say that this is all on your shoulders. It's not. And so with this particular issue, as well as just with all of the community risk reduction that you guys are doing in your communities, this is why those partnership building and stakeholders is essential. So yes, certainly build relationships with school counselors, because those are number one. They have connections and resources. I'd encourage you that in addition to that, think about in everybody's community is a little bit different. So I don't want to sound too ambiguous or too vague, but I also don't know what's available in your community or what that looks like. But other places and spaces where connections are, we have a real active 211 network in Michigan that is getting even better and better. And and I'm not sure, my understanding is this is kind of spreading in other areas too. 211 traditionally has been that number, that people can call to get connected to services. They're now not just doing that, they're actually proactively connecting with hospitals and with other places. But I don't know if you guys have been like recently, either you or your kid have gone in for a healthcare visit at the at a clinic or hospital. They're starting to ask all those questions on questionnaires pre-visit about like, are you worried about food, or have you not gone to an appointment, because of or all those
Transportation.
kinds of things. Yeah, all that kind of stuff. So they're asking those social determinant questions. They're now not just asking those, but if people say that they're having issues with those, they're now getting referrals are now being sent, and 211 is now actually helping connect people with those services in the community. So that's happening. That's happening in my state. I would suggest reaching out to 211, as a group, and seeing what they're doing, because you may be finding that they're doing that too. That was something new. I had no idea that they were doing all this, and it was like, oh my gosh, this is so awesome, right? Similarly, reach out to your state as well as your county Department of Health and Human Services, and see what kind of resources they have available, because they have different provisions of that, and a lot of state departments of health and human services have been tasked now with really addressing those social determinants of health, including that housing and the food and those types of things. And then certainly if a child or family has been involved with court, sometimes juvenile justice is another entity that, they can, and I don't know if anybody on here is with juvenile justice. So I don't want to speak for them, but like that's another stakeholder or partner that you should have involved in this, because they can be huge stakeholders and partners. And sometimes they're able to um, tie into like youth assistance, or basically pull in other resources or services that otherwise you wouldn't be able to get to. And then social workers. Yeah, and then social workers. So depending on if you're some fire departments and police departments and communities are now starting to do community mental health and other services like that. So the social workers those programs might be or another good asset.
Great, thank you.
Yeah.
Anybody else right away? To carry on with what Don was asking, I get the impression that everybody's a little worried, or not everybody, but I and a couple of other people are a little concerned about how do we connect these folks with mental health assistance besides, I mean, and I've got a call into the Department of Health and Human Services at the state level. But when I first called, they said, yeah, there's a list out there. They can go look at the list. I'm thinking, well, I'm not sure that that's necessarily going to help all of us. And, then we just start calling down the list and see who's interested in working with us. Or is that what we need to do?
Yeah, I know.
Develop our own list.
I hear you. So helping families access some of that mental and behavioral health services is one of the hugest barriers that I still struggle with in my own program. So um, don't feel bad about that. Universally across the country, that is a huge gap. And the problem is that our country does not, we still do not, we are still so lacking in mental and behavioral health services. We are. We knew that before COVID, and it was a slap in the face, glaring, like, holy cow, like this is just, we already had problems that worse. And people aren't just not getting services when they know they need help. They call for help and they're put on a wait list and all that. So don't long story short is don't feel bad. um the best you can do is compile a list of what is in your area if you will, and you have to be able to provide, try to provide it to the families and youth that you work with, and you just try to encourage them, right? Um, you don't you don't own and aren't responsible for making a youth and family do your recommendations. Okay, so don't lose sight of that. I know we all are like, we feel like we feel this big, like, everything on our shoulder, right? With it, you don't. All we can do is do our best to try to help support them and wrap around, and in the end, they have to be accountable and decide, and decide what to do with things. So in that thread or theme, though, um, knowing that those are barriers, I have a resource sheet that I compiled of local resources that I give to my families and youth of things that they can access that are specific in our place. And then also, through the Sean Story National, I compiled a more generic, like, list of mental and behavioral resources and kind of a guide for where to go first to try to help connect people with those. So you guys can use that and customize it to your own needs, if you will. So my in a nutshell, you don't have to reinvent the wheel on stuff. You can use what I have and then take it and, customize for what your needs are.
Right?
And I will, while you guys are thinking and asking, I can send stuff for an email, but yeah, I'll plug a little bit more kind of stuff in here so that you guys can start seeing a little bit of what I know it's hard when I'm talking in generics and you can't see it. So here's, I put together a link tree that has a bunch of the stuff that I've mentioned kind of in one place, if you will. So if you guys open that up, you'll see the webinar that I mentioned. If you go to the professional trainings tab in there, it'll take you to where you can find those National Fighter Academy trainings. On that professional trainings tab is also then where that online IFSTA and Vision 2020 training course is. If you go to in that link tree, if you scroll down and go to mental behavioral health tools, that's one of the buttons that's there too. And if you want me to screen share to show people, I can do that too if that's helpful. I don't know if that's helpful or not.
I see ACE is on
Let me
there
see
too.
here. Yeah. Can you guys see the
Yep.
link tree now? So at the top, this is just basically a way of compiling a bunch of links and websites kind of in one place. So if you do that link tree, you can go, and like I said, here's the webinar, and when you click on it, it takes you to a different place. If you scroll down here, there's mental behavioral health tools. That'll take you to like a handout, if you will, that describes some of the common mental and behavioral health conditions that fire setting youth have, and it describes it not in our us healthcare clinicians love like sounding all like, high hoity-toity, if you will, or whatever. So like the descriptions of the mental health stuff are more like people, like, easy to understand, and it gives some really like warning signs of when is this, like, we got to call 911, or we got to take somebody to the emergency room right now for, like, I call it mental health bleeding out. I'm also a trauma nurse, so like, when somebody's got life-threatening bleeding, we don't just let them bleed out on the ground, right? We do stop the bleed. So the same thing can be with a kid that we're working with fire setting. When are they bleeding out, from mental health? So there's a handout in there that'll walk you through stuff like that. The ACEs, there's stuff in there, resources and tips in there. The coach packet that I use in my programs here. I did a podcast with the National Fire Protection Association, or NFPA, on ACEs or risk. That's in there if you want to see it. What else was I going to bring up? Oh, here, if you want to see what my program looks like during COVID, I flipped it, if you will, and I basically built kind of like an online, like activities driven thing that youth and families could do while we couldn't do our in-person class. So if you want to see some of the interactive activities that I use in my youth fire setting program, they're here under the University of Michigan YFPIE course. So you can grab into those if you want to. Yeah, so whatever. Here's basically a compilation of a whole bunch of stuff. If you guys want to use that.
But fantastic. Erin is in the chat. She asks have you created another version of Sean's story? I thought that was helpful to hear his view as a youth fire setter.
We have not, because that was created with grant funding. But having said that, Sean actually works with me still in the program that you teach. Yeah, he's one of our speakers and teachers that is in the program. So we have talked about the need to do a kind of a follow-up on where is he now and what is he doing and what worked or what didn't work. So is that kind of what you're asking about, Erin? Or do you just mean like another video in general?
I think that would be awesome.
Yeah, he just so you know, because everybody's always like, well, what, how many of you have seen that video? Is that so? If you haven't or want it, it's now about 10 years old. I mean, it still holds true to a story and what we would do, and that is free. You can request it electronically and all that. Just make the request on the Sean Story website here. This was created through a FEMA grant, so it's your federal dollars at work, so use it. You can request the video. So Sean is at the age of 15, he went and set a fire that burned his high school, and it caused about $750,000 in damage. What is interesting about his story is he had previously set fires as a kid and never got any kind of intervention, never had any intervention done. And fast forward, he held true to what we know in the data and research. If a kid sets fires when they're younger and there's no intervention that's done and only punishment happens. And so in his case, he was experiencing some bullying at school. Some other things were going on in his life. He didn't like school. It wasn't going well. His grades were dropping. His parents, and this is the back end of the story that you're not going to see in the video. His parents grounded him, punished him. It was all punishment based and not redirection or support in any way. So he decided he wanted to not have to go to school anymore. So he did things as teenage brains do, and decided to take things in his matters in his own hands and try to get rid of the school. So that's the story of it, and it goes through then what happened. He at 15 has 4 felony counts on his record. He was treated though, or basically he was held in a juvenile detention center for 3 years with it, but he still has a suspended sentence, meaning that like still if he has another charge as an adult, he could still actually go back to prison to serve time for that incident that happened when he was 15. But he's doing well now. I didn't hear from him for several years, and he wasn't doing well with things. So it's kind of that, story of not, we do our interventions and we help support them, and there can be bumps in the road like life handles, but he's living proof that what we know in the research and data about adverse childhood experiences and evidence-based youth fire setting intervention, if what we know through all that is that if there is a caring and consistent adult, at least one, and the more that there are, the better. That shows that they care, that shows that they have that kid's back no matter what, that just shows that kid that they respect them and they matter. It makes a difference and they will do well. And he is doing well. He's married and has a kid of his own, and he wasn't able to find employment in traditional ways because nobody wants to hire an arsonist, with multiple felonies. But he actually started his own business. So, kind of cool story on that side. What other questions? Where are you guys at? So I want to hear from you guys. Tell me where you're at with things, and where are you trying to, like, kind of what questions do you have, or what struggles do you have, or where are you at, and what's kind of where are you like saying, oh my gosh, I don't even know what to do right now, because we've all been there, and I still have those days.
Carla, this is Dawn again here in Fargo. I guess our program definitely needs some work. We kind of modeled our program off of a little bit of Minnesota and then some Oregon stuff. But it is, I guess our biggest struggle I kind of touched on earlier is just getting the kids the resources, because it's kind of a helpless feeling in most cases when you do the education and know there's so much more that actually they are in need of. And I have worked with the juvenile justice system in the past, and that, I don't know how that was probably, 7 years ago now. I don't have a good resource over there, I wouldn't say. But I would be curious to know, some of the struggles is like, we do this education and we might not see them in our system again, but I still worry, like, just because we're not seeing them doesn't mean that they aren't still having issues, or, so I guess that's, not having closure, but that is what it is. And we always deal with that in our business. But just the biggest struggle is, building those relationships and getting that child the help that they need beyond the limited education that we can provide. And I think, some of what you've said today has been very helpful. I looked at some of your resources that you've provided. I think anything that we can provide to them or their family. And the other thing is, the families also want to, they have to want to, excuse me. I've had some families that absolutely do not want me involved for whatever reason, I suppose because I'm government or whatnot. And other families have come to me asking, hey, we need more help. Is there anything else you can do? And that's a good feeling, because then you kind of walk away going, okay, maybe some change will happen here, because they do have appearingly a caring foundation that wants to move them in the right direction. So that's kind of where we're at. Our program definitely continues to need some work, but that's where we are in Fargo.
Thank you for sharing that. I'd love to hear from others too. Yes, I crave having families that want help. To put it in perspective, I currently have around 50 referrals, outstanding referrals. So 50 referrals for families and youth that I can't get them scheduled for the class or the intervention, and that, despite like trying every possible angle of, nice nurse and this and that and whatever. So I feel your pain and I hear it. They don't they don't want help. They don't want to get involved for many reasons. It can be, fear of admitting that like their kid actually did do something and they don't want to get into legal trouble. It can be because they've just got so much going on in life that they just can't like even handle one more thing. There's all kinds of reasons, right? Why people don't want to do that. And it is frustrating because we're there to help them. So the way I look at this is we are planting seeds. We're here to just plant little seeds of helping. Like, so we have the opportunity to be something positive in their life. Okay. So rather than them feeling, so what I can tell you is there are a lot of families and kids who just feel like a whole bunch of adults and a whole bunch of agencies just keep heaping up on their back. They feel beat up. They feel that like there's just one more group that wants to tell them how bad they are or what they're doing or whatever and all that kind of stuff. So if you just have the opportunity to say, hey, we're here to help support you, to help keep your family safe. Here's some, resources, some things that we're here to help you with. Um, that alone, just saying that can make a difference. And then offering them what you can offer, here's a list of, so I'm not a believer in just passing out handouts and thinking that's going to like make a huge difference. But what I am going to say for these families that I have referrals on that I haven't been able to get them scheduled, I still go ahead and send them by email, by text, if I have it, by mail, whatever way that I can get stuff to them. I still send them resources, that some key ones that will tell them the right thing to do, give them some resources and when to get help. And I always offer them if they need smoke alarms and lock boxes. So the tools that would help them do the right thing and try to prevent the youth fire setting from happening. And so then I have to say that I would love to do more. I would, but we're at least doing the best that we can, right? And that's what our role is. We've tried, and I believe, and I know that that is still making a difference. Maybe they're just not ready right then, but they are going to remember that somebody cared, somebody took the time to share some resources with them. Somebody was positive and believed that they could do better, or not told them how bad they were. They actually believed them in them. That's going to make a difference. It really does. And that's not just me being like, Carla, like, I don't know, people are like, oh, you're from Ann Arbor. You're one of those tree hugging, like, let's sing Kumbaya, right? That's not what it is. This is what the data and research shows us on what will make a difference. And if you think about it, it does, right? I mean, if they've already had adverse childhood experiences and if they have, it's very likely the parents have had also and or witnessed violence or other things. If you think about that repeating amongst multiple generations, they've already been beat up a lot, right? Do we need to come down hard on them and be one more person who's done that? Or can we try to start making some change for them by showing some positive redirection and showing that we believe that they can do something different. So I don't know if that helps or not, but that's how I approach this. And it's also the only way that I can keep myself doing this work, or otherwise you're going to get burnout. If you see all this as a failure, you're not going to stay in this work very long, right? You gotta flip it around and say, I tried, I gave them the stuff that I know that works, and I know that like this is planting a seed, and someday, if there's enough seeds planted from a bunch of different entities, they're going to be ready, and it's going to make a difference, and it's going to help them.
50. That must be an overwhelming list.
What are you
Alright,
guys
who
doing
else?
about data? What are you guys doing about data and tracking? Are you guys familiar with Wi-Fires? that's another resource if it hasn't been mentioned.
That's one of our resources, and we've talked about the fire marshal's office is getting into bats, and we've talked about entering information in there also. It doesn't feel like enough, but again, it's what we have.
Yeah, just consider, if you guys aren't using, consider Wi-Fiers. It's free. It started with other entities through a grant, but it's now Vision 2020 is now overseeing it. I was part of the group that helped develop that too, with stuff. So it is a system that anybody that you allow access to can enter data. So that's the kind of the beauty of it, as opposed to like bats or other systems where there's only certain professionals who can, do that, if you will. So I'm just throwing it out there as an option. Wi-Fi's, it was set up very intentionally to be a two-tiered system. So meaning that there's national data. So there's like 20 de-identified data elements or data points that would get uploaded to the national system to try to help with understanding more about this issue and bringing more awareness about it. But the thing I love about it, and the reason why really for me it was all built, was the case management piece. So the other tier of this is there's the case management part of it, that there's about 160-ish data elements that are all voluntary. You can pick what you want to put in there, but that's a quick and easy way for you to track your cases in there. You can use as many or as little of them as you want. And depending on the way Wi-Fi is set up, you can either have a department set up their own Wi-Fi's, or if you're looking at doing a coalition or a state, you can set up one account and then give people different access levels. So it's flexible that way to set it how you want it to be, if that makes sense. So some people are doing, like for my program, I'm the one that has the access, and then I can give other people access. There's coalitions that are multiple departments and multiple different disciplines and different agencies that are participating in that. So you allow somebody to have the high level access, and then you can allow other people to be like data entry people, if you will, so they can enter cases, and that can cross departmental lines. And so then if you do have somebody like myself that's at a hospital, that's one of your people that are tracking or doing cases, they can do it too. I'm just mentioning that because if you think about it, I can't enter in NFIRS. I won't be able to enter in NERIS when that's out. You guys can't enter in my burn registry where I would otherwise track patients or whatever. So that's just one option, if you will.
I like it. I've made some notes, everybody. So when we wrap this up, I will send out some information and ask some questions about what the group would like to do. But anybody else? Erin, you always have lots of questions. Kind of quiet.
If you guys
I
haven't
thought this was fantastic.
Oh,
Yeah,
okay.
I did a whole bunch of research and I read all of your stuff. So yeah, this is excellent to hear you speak in person.
Well, thank you. I mean, I'm trying not to overwhelm, because I know that's not my goal on on things. So if you guys are just kind of starting out with things and not sure to backtrack, if you have to prioritize things, because we've all been there, right? And and trying to say, hey, oh my gosh, what should I do now or whatever. I would start by saying, consider that online IFSA course, that Introduction to Youth Fire Setting course first. The arson awareness webinar is another one, because those are two quick, they're each about an hour. You could do that. There's introductory stuff. If you haven't already taken the National Fire Academy courses, I would strongly recommend at a minimum taking the Youth Fire Setting Intervention Specialist. That course, so the cat's meow would be to go do the 6-day course somewhere that gives you the full on, but that's, I can understand that may not fit with what everybody's doing. The 2-day Youth Fire Setting Intervention Specialist is the course that's geared towards doing this kind of everyday work. It gives you the typologies, the motivation, it gives you all the terminology stuff, it gives you the background, it talks about the tools and all the things that you need to do that. You can take that, that is offered as a 2-day course that can be offered in your state. If you guys haven't offered it, that is something that you can have requested be brought to the state so it can come to you. The other one that I would recommend that is just brand new, that just came out, is the 2-day Youth Fire Setting interviewing and educational intervention. That is, so that you have to take the intervention specialist course first, and then that 2-day interviewing and education intervention course is a build on of that. So that's then saying, after you've taken the intervention specialist, it's that whole like, oh my gosh, I want more information about how to interview youth. And I also want more information about how to do that educational intervention. So that 2-day course is brand new and is helping to fill that gap. And just even if you have taken the Fire Academy courses, all of them, the whole suite of courses, so the 2-day intervention specialist, the brand new 2-day interviewing one, and then the 2-day program manager. And so those 3 2-day courses are now what equal the 6-day on-campus one, either at Emmitsburg, or they're doing that. They are bringing the 6-day to some different states around the country. That whole suite of courses, if you will, were just revamped 2 years ago, or and newer. So if you took it a long time ago, it's a whole lot different now.
I
have a
Those are
question. This
good.
is Jill out in Williston.
Go ahead.
Talking about these courses that, and being able to justify how much time you put into training and how much time you put into like youth fire setting programs. I don't even want to say it because I don't want to jinx us, but we haven't, my gosh, I've been here almost 10 years, and I think I've had one case where it was a child that did something, and even in that case, it wasn't like an intentional or malicious or it was very beginning stages, and it was, he was really, really young. I guess my question is, we're not noticing, we haven't run across much of it. How much training do you recommend we do if we're in just kind of like a maintenance state, or like a maintenance period, just to keep us up on it? How much training would you expect or want us to do? And then also, I guess my other question would be, are there situations where it's happening, but the fire department isn't involved? Like the parents are seeing it happening and they're going right to a different source for help or reporting it somewhere else?
Okay. Yes. To answer your question, thank you for that. Because yes, I totally hear you. So first, I'll answer your last question first. Is it happening in more places, and are people going to other people than you? Simple question is yes. Let me put it this way. So I had our state fire marshal pull 10 years of NFIRS data, and then I matched that with 10 years of my program data. I personally saw 3 times the number of youth in those 10 years than what was reported across the entire state of Michigan. And if you think about it, the state of Michigan includes that little tiny city called Detroit and Flint and a whole bunch of other whatever. So I will say, I hear what you're saying, that you're not seeing it. I'm also going to say that you're not hearing about it. And so for my program, I only get the referrals I get, only 25% of them come from fire departments. So that means 75% of the youth that I get are coming from other places and spaces. So definitely you guys are not seeing, all of it, right? So part of what I'm going to suggest is, as you're kind of building your partners and collaborations and that, we all need to do more awareness building. There is more fire setting going on, but the adults that live with, work with, and I always say play with, but that sounds really bad in this arena, like, because that has different connotations in really bad ways in this space. But the reality is the adults that are around youth don't know that this is a problem or could be a problem if we don't do something about it. So they're sweeping it under the rug is really what's happening, right? So you can build awareness about why, if a kid sets a fire, why they should want to reach out to you and do intervention with it. So I think you're going to find that there's more happening than what you're seeing and aware of, for one thing. And why I started screen sharing again is that's why this FFIT, or fire setting identification tool was built, because and you can read more about it, but single-handedly, we know that we're not identifying the youth who are setting fires. So that's a tool to try to have more adults looking for it, and then notifying and knowing what to do about it. Okay, so that there's that point. But then also, I hear what you're saying on, is it worth investing resources in a problem that you don't think is a big issue? Here's what I would suggest thinking about. And this is kind of what I'm suggesting across the board for a lot of community risk reduction and fire and life safety, or FLSE topics. Can you think out of the box and think about, should we in each of our states maybe kind of divide us up regionally? And maybe in a region, should you have a youth fire setting, FLSE, kind of CRR lead, if you will, and you kind of pool training and resourcing into that person, and that person can kind of be that contact for that covers more than one fire department, so that we're not doing our traditional siloed, like every department has to do that. I'm totally throwing this out of the box, this is Carla's like scheme for the world in another day. I mean, if you think about it, you already do mutual aid, right? For larger fires. Why are we kind of not doing that for topics like this? Because I hear you. I think rather than having every department be trained in this, I think we should be thinking about, regionally, could you say that for your state, maybe you would have X number of people that would become your intervention specialists, and then have an intake come into the state, that have, like, if there's a youth that's been identified, you have maybe 4 or 5 people in the state that would then try to be that, or it would set up to do that for you. Does that help at all? I don't know. I'm just trying to kind of throw it out there because I hear what you're saying. I think we need to rethink all this.
I think everything that you said was helpful. I think it's really helpful to know how much of it how much we don't know and how much we don't know is going on. So even if we're not seeing it, just having it in the back of your mind that it's still, and I'm not saying that it's not important, but that it should still be somewhat of a priority, even though it's not right in front of our faces. I mean, it totally makes sense to have some kind of I don't know, an organization or some kind of a way to divvy it up, or I don't know. Yeah, something like that would absolutely be helpful. But I know everything that you said is very helpful. Thank you.
Yeah. And on that note, do you guys have partnerships with tribal, with your DNR, Department of Natural Resources group? Because there's fire setting going on DNR lands. There's also fires going on in tribal areas, and those are being handled in different channels or venues also than what you're hearing.
Yeah, in our area, I don't believe there's any. Yeah, I mean, and like I said, I mean, in our area, I don't know of. I mean, truly, we've just had one, maybe two incidents in the whole 10 years that I've been here. So it's just seemed to be so minimal. But it still is maintained as such a high topic. You know, I mean, it's obviously happening. So I don't know.
Schools are another place. Schools are having incidents happen and not reporting them. And that's happening across the country too. And we know it's happening. Sometimes they'll reach out to me and they won't ever tell the fire department. Our state fire marshal looked back, and I think he said for the last couple of years, there was somewhere around 150 plus fires at schools that actually had gotten reported. But again, in looking at them, how many of those do you think actually probably are youth related? Probably a fair amount of them, right? With it. So that's another untapped, we know incidences are happening at schools. So to develop relationships maybe with those school resource officers and or school staff can be really beneficial, to where they don't just put it out and not understand that they should be referring a kid, because it's going to likely happen again. And that's kind of where that Sean story video can be helpful. It's like, look, if you just sweep it under the rug, or we don't try together to work with this kid, something bigger could happen.
Yeah, in Williston, I know that we haven't reached out about that, and I think that's an excellent idea, just to reach out and let them know that we're available to help with resources and help with whatever. I really, really like that idea.
And sometimes, I'm sorry, I've also heard that with police, sometimes law enforcement can be involved in something and they don't think to reach out to fire service. I know of a lot of cases of that too, both in my own program and elsewhere. Law enforcement will just deal with an incident and then not think to involve fire service. Go
And
ahead,
I'm guessing they're dealing with it a lot differently than we would have.
Correct.
I'm wondering if when teachers have in-service days and some of their conferences and things, if that wouldn't be a good place to talk to a large group of teachers and administration. To think about on my list. Okay, it's 9:59, everybody. Anybody got any last minute? Okay. Thank you so much, Carla. We really
You're
appreciate
welcome.
you coming.
You know how to get a hold of me. So
Great
just
resources.
if anyone has any follow-up questions, please feel free to reach out directly. And all that stuff I mentioned is in that link tree.
Okay.
So if you have any follow-up questions, Marcy, or anything, just let me know.
A lot. Okay, will do. Thank you.
Okay. All right.
All right. As always,
Bye.
I'll stay here for a second in case anybody needs me, but otherwise, have a good Friday.